Welcome to Block 6, Assessing Health Literacy. I'm Dr. Sadia Ghazi, Lead Educator in Physician Communication at Loyola. What makes understanding difficult? The definition of health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Why is it important for us to know the importance of health literacy? Only 12% of the US population is actually proficient in health literacy. Poor health literacy is associated with poor outcomes, poor knowledge of patients' own medical conditions, problems taking their medications, leading to increased hospitalizations and increased ED visits, and also leading to increased mortality. There are some red flags to help us identify low health literacy in hospitalized patients. Patients demonstrating non-adherence with their medications or having difficulty describing how they take their home medications are red flags. Difficulty describing their current medical problems or their medical history is also a red flag. And we should be aware that oftentimes these patients seldom have questions. There are some steps we can take in overcoming the challenges of poor health literacy. Be aware our patients generally have a grade 4 to grade 6 literacy level. And during stressful times, a patient's understanding can be reduced even further. We should speak in a slow and deliberate manner and have frequent pauses when providing new information, and always assess to make sure our patients have understood the information we are telling them. We should use plain language and avoid the use of medical jargon. New information should be limited to 1 to 3 items at a time. It is also very important that we do not provide false reassurances to our patients and that we are upfront and truthful about their medical condition. Another skill we will be learning in the next block is how we can avoid long monologues with our patients and how we can instead engage them and change our monologues into dialogue. This month, make it a priority to identify patients who show these red flags of poor health literacy. Provide more time for explaining and assessing their understanding. Utilize available education materials, and ensure assessment by social work for any available resources the patient might need.